don't suffer in silence. That's something that I say frequently. And don't be afraid to say how you really feel. Join a group like ours and say how you really feel.
So, hello everyone. I'm Samantha, the Director of Patient Advocacy and Outreach here at Heal Mary. And we are so grateful to have Hannah and Lisa here today to talk about lymphoma. So, Lisa and Hannah, would you like to take a moment to tell us a bit more about you, who you are? Lisa, if you'd like to go first, and then Hannah after.
Oh, thank you. Thank you so much for having me. I am a blood cancer patient with kind of a rare one that's called chronic lymphocytic leukemia, or CLL. And I became involved during the pandemic, kind of early on in the pandemic, with a British doctor who was looking to start a support group. So we started together Blood Cancer Uncensored, started as a Facebook group, but he is a writer also. And he started the website, which is bloodcanceruncensored.com. So we didn't know what we were going to do at first, but it's evolved into kind of a bigger thing. And here we are having a meeting, for example, with you folks. But from day to day, I actually work full time. I have a regular job, and this has become, a great passion for me, helping others and connecting them with resources. So that's how I got to where I am now.
Yeah, that's great. Yeah, I mean, it's so exciting to have you here, Lisa. And yeah, I'm just really interested to hear a lot more about your own patient journey, and then also about, how Blood Cancer Uncensored has changed over time and everything. But so my name is Hannah and I work for Heal Mary, and like Sammy, I've been working here for over 2 years or so. Just like you, Lisa, I started in the pandemic time, but I'm the clinical research and strategy lead at Heal Mary. And so for my role, I have a science background, and so I'm focused and trying to make clinical trials easy for patients to understand, and trying to kind of translate the scientific terms that are confusing to more layman, easy to understand terms. So I know a little bit about CLL, and I've heard that with a lot of CLL patients, it's very watch and wait type of treatment. And so, correct me anytime I'm wrong, but from my understanding, like if you don't have any symptoms and you're generally feeling okay, then they don't treat. And then like you're talking about when you do have treatments, it's not really chemo based and it's more targeted type therapies. And so, yeah, that totally makes sense why it'd be really useful having a support group, because I can't even imagine, hearing that you have cancer and then them saying, let's just see what happens. Like, so what was that like when you were diagnosed, and like, so now you've met other patients with CLL and you can kind of
I think a lot of people go into therapy after they get diagnosed with CLL, or this, heavily into the support groups. My journey was such, I, personally, and I blogged about it too, in January of 2016, a very good friend who just always bonded with my heart, but had moved from New York to North Carolina. She would always call me and just say, you need something. What is it that you need? It's in my heart. You're on my heart. And this time she needed something. She was losing weight rapidly. She had had a number of medical problems, didn't know what it was. And I was never properly diagnosed until I think her non-Hodgkin's lymphoma was in late stage. That's what I think happened. It happened so fast that I don't really know what happened, because she died. And in the meantime, I developed a lymph node on the back of my left ear, and also had been having some kind of lengthy illnesses. Whenever I got a cold, I was starting to get a little scared, but I just thought I was getting old, because it would last forever and it would morph into bronchitis. And I'm a toughie. I'd still go to work and get through it, maybe take a day or two off here. But I never thought to ask the doctor about the lymph node, and they wouldn't give me anything for my illnesses. My doctor's office was very conservative, so I just stopped asking. So then I did a physical. Well, I'm sorry, a few months earlier, my father had some weird blood work, and they said, you need to go see a hematologist. So in the fall of 2016, and now my friend is deceased, and it's just all these things. He needs to see a hematologist, and he asked me to take him. So we meet Dr. Vlad, and she diagnoses him with myelodysplasia, which we had no idea what that was until that was diagnosed. And then a few weeks later, I get a physical with my own personal physician, and the white blood count is high. And she's like, we gotta take a look at this in a couple months. Let's just check and see. And again, I never mentioned the lymph node. Just thought it was just okay. And I think that would have helped actually. But so in November of 2016, I had the second blood work done and it was still high. So guess what? Lisa got referred to a hematologist same year. So I didn't know, they weren't very helpful at the doctor's office because they don't know what to do. They're like any hematologist will do. So I picked Dr. Vlad. And so we go in there, and I think this time I just brought Dan along because I'd been going with him and she already knew us. And she said, I'm not happy seeing you here in this capacity. And I said, I'm not either. And I was 45 years old. And so she did do all the proper testing. It just was extremely difficult with that particular hospital system. It was Christmas time and everybody was closed and it wasn't convenient. I had to go to one place to get it done. I was getting frustrated. I almost thought I'm going to give up. But I got it done before the follow-up appointment. So on January 5th, 2017, she handed me a piece of paper, said, this is a good cancer and you don't really need to worry about anything. And, there's much worse things, and have a nice day. So my husband and I went to lunch and we just sat there and I said, do I have cancer? What do I have? I don't really know. So I went to work that day. I'm like, I think I got cancer. I'm not really sure. He did all the research. So in that evening, we had a full-blown discussion. And I was still like, well, what do they do for this? Because they do nothing, as Hannah said. So we're into 2017, and you get appointments, I think, every 3 months, and you kind of win that ticket with the hematologist. So I didn't really mesh with her very well. My dad was stable, so I wouldn't have mattered anyways. He doesn't need treatment, ironically. So he stays with her, but I picked somebody else, and that doctor's office actually gave hugs and everything, and it was pre-COVID. And I stayed with them for a while, but that wasn't really his specialty. And then he told me about the CLL specialist in Rochester, New York, where I live. And I wasn't ready to make the plunge, but you can just make an appointment with them because they're a research hospital, and that's called Wilmot, WILMOT Cancer Center. Beginning of 2019, I think the first appointment might have been May of 2019, where I'm now comfortable going to a busy cancer center and seeing cancer patients all the time. That was a big deal for me. In 2018, I had the opportunity to take a lady for treatment there who had brain cancer. So I got to know my way around, and it just felt okay. It turned into from a kind of an ugly place to a friendly place. So, so I switched over to Dr. Barr permanently. Early 2019, everything was fine. And in the fall of 2019, now all of a sudden my lymph nodes are coming out all over, which is one of the potential pre-treatment. You do a lot of reading, it'll blow your mind, but they don't necessarily treat because of that. They look at your white blood count, they look at the size of your spleen and all of your internal lymph nodes. You get scans done to measure everything. And they keep an eye on things. They also look at your genetic factors, and I have absolutely no predisposition factors at this point, but there's a mutated thing and then there's an unmutated. So I have the good version of it. So, they're just going to watch it. And then, during your cancer journey, you change your diet, you exercise more, and then you learn that yes and no doesn't really make a difference, but you're still helping yourself to prevent other diseases. So all that's going on in my mind. So I just didn't really understand blogging. So I had a thing off my Facebook where I started writing about health and wellness. I didn't really write about my disease at all, but just sometimes there would be a question. They're telling you to take supplements. They're telling you to get vaccinations. You're like, I'm being told to get vaccinations if folks in their 60s get, and I was just like, I don't know what all this means. So that's where I would kind of voice it during that time period. So in November of 2019, my hospital being big on trials, and they hand me some paperwork, and they never really said you need treatment. So, and this is where the local support group that I had started attending in 2019 came in very handy. Three of us were presented with that trial, and all three of us didn't think we needed treatment. Well, we're not doctors, but that's fine. And everybody was really good and supportive and professional in how they thought, well, yeah, maybe you can continue to wait, right? So with CLL, sometimes you can become hospitalized with chronic, pneumonia and respiratory issues mainly. And that might, also be a reason to try to treat, but the immune system is already destroyed on this disease. It's possible I've had immune problems for years and didn't, the CLL wasn't woken up. There were signs of that, but nothing super major, but annoying things like my eyelashes falling out in chunks. Like my mouth would kind of swell up for no reason.
Can I ask you a quick question, Lisa?
Yeah.
When you were talking about, being told that you've got the good cancer, there's no treatment needed, and then yet they're presenting you with a clinical trial, how does your mind consolidate the two?
In the journey, it's really the first doctor that said, you're good to have a nice day kind of thing. Everybody else was like, yes, treatment is possible, and you may never need it, you may need it. So it was handled differently at that point by the specialist. But yes, indeed. So between November of 2019 and about February of 2020, when I met with Dr. Bargan, just said, no, I'm not going to do this. We're going to wait as long as we possibly can. And he was always very good at recommending that as well, because I know a lot of people that are in the same boat as me. It's like, can't we just treat this thing and get rid of it? But it doesn't go away. There's no cure. So that's how I met Adrian Warnock, is because he had decided to start a WhatsApp chat group for CLL patients. And I started bombing him with questions. Why are they offering me this trial? I sent him my blood work. This is what we do. We're such nerds. He's like, and everything he said really was right, in my opinion. It's just, there's so many aspects of the disease. So, now the lymph nodes are getting bigger. I start growing my hair long to cover them.
Yeah.
Still in the office. We were in the office at work until middle of March. And then we got sent to work from home because of the pandemic. So now I don't have to worry about how I look or anything like that. But it really was, because somebody described it as the Incredible Hulk. It's a real esteem breaker for a woman, particularly.
It's a really great thing that the hospital you were going to was a research hospital. And so they present the three of you and they say, this is what's available. And so then you can choose between taking acalabrutinib or engaging in a clinical trial, and what the options are out there. Mm-hmm. And I think with some patients, depending on where you're going, can you imagine if you stayed at that first hospital that said, let's just not treat it, you're fine, it's a fine cancer, and then they're thinking, I don't even know what my options are, what can I do? And so I think with some patients, they don't always even know what's out there for clinical trials. And there's so many options. Your hospital had one, but across the United States, there's over 800 trials recruiting right now for lymphomas and over 700 recruiting for leukemias. And so I think, it's just really knowledge is power. And it's a good thing for patients to know that there's options there. And then so you can take it and bring it to your doctor and say, what do you think about this? Do you think this is a good option for me?
Yeah. Yes. And it wasn't just that trial. They definitely have all of the trials that that are available. It's just he was trying to recruit the correct number, and he looked at his patient load and he thought, can we? And it wasn't, there's 4 doctors and there's CLL specialists, so we all had different doctors. And then one other lady was very thankful to actually be on the trial. Her health has been very bad, and she did the trial. And they kept it open for her. So they have the ability to do that. I don't know if anybody knows that, but they'll get you in if it's still feasible. And we have another gentleman in the local group who's relapsed, and he was part of a different trial, and he's exploring his options, but there's a possibility that he will continue in the trial. And what I love about it is they keep track of them indefinitely and can continue providing information to future patients.
Mm-hmm. I'm curious, Lisa. So I guess a few people in your Blood Cancer Uncensored group have done clinical trials. And then when I was reading some of the posts too, you've done patient stories where patients have undergone them. So I'm just wondering, like, can you speak about what the general feeling is about clinical trials in blood cancer? And are they scary to patients, or is it something that everyone kind of considers and is aware of?
I don't know if everyone considers it because I think sometimes age is a factor, but for the younger people that I follow, they were on a more recent, there was a couple of ladies that were on a more recent trial and were very verbal about it on Facebook. And they went in, fighting strongly and, hoping for what we call deep remission. One of the things with CLL that's disturbing is the word deep remission because there's no cure. And so I actually had to look that up when Dr. Barr said that. I was like, what do you mean deep remission? As of this time, there's no cure. So it's we hope for at least 5 years, if not longer, when we've come off of a medication. So mine's different. I have to take, the medication every day indefinitely. But for those on the trials, they've been, some of them have been able to come off completely. And I just think that's great. And I'll be watching the two ladies that were on the trials in 2021 to see how they do and to see if those drugs get approved. That's the other exciting part about being part of this. We sometimes, or wait, I'm going to reword that. We often know more than our doctors do, with the exception of somebody like the CLL specialist in a trial hospital like that. But, there's been so much buzz about COVID and things that we're educating them. And I believe that that's where we are very important as we have a tiny voice by ourselves, but as a group like Blood Cancer Uncensored, we're huge and able to do much more.
Mm-hmm. Yeah, I think that's such a good point about how now, I think in the past, like kind of the sentiment around doctors and stuff, as you go to your doctor, if they say this, you're like, okay. But I think now things are really different where, yeah, there's so much information. And then through different groups too, where you guys share different information, like, yeah, you're able to educate doctors about this or to bring up multiple treatments and then ask what they think. And so I think that's really cool. And I guess that's what you do a lot is you create a ton of content on Blood Cancer Uncensored. And I saw that, for different therapies, like you're bringing up, this is the new finding about this, and this is what was published here. And so print this off and take it to your doctor, right? And I just think that's really amazing.
I've subscribed to a bunch of things that allow for that to happen. So in the morning, I eat breakfast and drink coffee and just see what's out there, trying to get caught up with that. See if it looks like it's useful for the group. There's a lot of things published that sometimes aren't very helpful, in my opinion, but they're getting there. I'm glad they publish them, but they're not something that is earth-shattering. So hopefully the content is good. The bloodcanceruncensored.com is more of a permanent place, so you can search it and find stuff that's technically obsolete now. So, Adrian, being also a CLL patient, also has a very bad immune system, very, very bad, did have the old treatment, which is called FCR. They're still using it to a certain extent, but it is a type of chemo, but not something as intense as what the acute diseases go through. But he was pretty isolated because of his already bad health. I mean, he'd already been hospitalized several times for pneumonia. And pneumonia, unfortunately, is what's taking a lot of the COVID people, when they, it's called COVID-related pneumonia. So he just went nuts, just making predictions and just suggestions and ways to, things to ask for. He got on the trial for now available or somewhat available Evusheld treatment, which is helpful toward COVID, that we all are trying to get it, basically, to protect us, to give us antibodies against COVID. So it's fun. I started out writing what I call experiential writing in my journey, and a couple other people that do that, which is always nice, and that's been useful because recently we had a member who had pretty much, bam, 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 was fine, and then wasn't. So, he's able to go back and read up on the other folks' similar experiences to see what to expect.
Obviously, Blood Cancer Uncensored has been there for people through this really difficult time of COVID, and also, going through treatments and, just being there for each other. But I'm just curious to know about some of the stories of these people that you've helped, or just stories that stand out to you of strength, and yeah, is there one you'd like to share?
I don't know if you saw the YouTube videos, Hannah, on this little boy. So apparently the father had joined the group and never said a word about his son. Okay. So the family is from Nigeria, and I think they're like a family of 5 or 6, mom and dad and the kids. And Nathaniel was one of the children, and at the time was 9, so he should be 10 now. And it's totally unrelated, but probably related. He had what's called myeloid sarcoma, soft tissues of the eyes. So he lost an eye in Nigeria. They were treating him there. They traveled to London in probably November of 2020 to get a prosthetic eye fit. And they apparently, a lot of folks do this who don't have good health care and will pay out of pocket for it. So they took a closer look at him and determined that his cancer, what originally caused it, was now acute myeloid leukemia, and he's only 9. So one of the interesting things about this is it affects very few children, and somebody living in Nigeria probably would not have a fighting chance unless they could get to another country for treatment. But they didn't know. They had no idea. So they admitted him, or they stayed there and took care of him until he posted something on the Facebook group. And Adrian saw it and he ran with it, because it was him asking, I think, for permission to fundraise, because at that point they needed more money to take care of their son. So what happened with this family is they met, they're very friendly wherever they go, and they made a lot of friends in the area. So there was like an administrator running the fundraiser, and they now were trying to raise the funds to pay the enormous cost. It was in pounds. I think it was over 100,000 pounds they needed to do a stem cell transplant, and also to pay their, some of the miscellaneous expenses that were still due. And the stem cell transplant for that particular condition, that's a cure. That's a cure. Now, for the older woman that I just discussed, I don't know the reasons why it didn't work, but it's available for all age groups. Obviously, that made me very happy, is that they wouldn't discourage an older person, but everyone's heart goes out to a child. He's only 9. So we did take them on as a special project to help them raise the funds, as a media outlet. There were several organizations in England that also helped them, the media, and they did interviews with the family as well, so they could raise the funds, and they were successful. So he had his stem cell transplant. So if you look closely inside, trying to think of it where it recommended it, but there's a YouTube video, which I did find, that's just extremely inspiring, showing Nathaniel ringing the bell. And, for anyone who's had cancer and been through chemo treatments or something like the stem cell transplant, apparently, when you are done, you get to ring the bell, and it means it's a victory cry. And they made a very beautiful professional video out of it. Like Simon Cowell is on there. So yeah, so that's not us that did that, but we helped. And Adrian interviewed Evie, Nathaniel's father, and it's a very, very we talk about miracles. We talk about being in the right place at the right time, because again, if they weren't there for the eye, they wouldn't have known, and he would have probably died. So, and also during that time period, and possibly because of trials, there was a drug that was recently approved that Nathaniel was on that brought him into what's called his remission. They called it remission. to get him to the point he was healthy enough to have the stem cell transplant. So that was between November of 2020 and May of 2021 when they were raising the funds. So that little boy spent like the summer in the hospital recovering from a stem cell transplant. But he seems like such a wonderful, loving child that he didn't mind. And you know, for any of us that watch St. Jude's commercials, right? I mean, it's the real
Yes.
deal. I don't, you know, people need to see that stuff because it's part of a chunk of their childhood that's being taken up. But hopefully for a cure that will allow them to live normal lives moving forward. So that's what we assisted with Nathaniel Nabina through his treatment journey.
That's such an incredible story, Lisa. And yeah, it just shows like some of the impact that you're making through this community. I'm just curious to know, like from what you've seen, how do blood cancer patients feel about their education, their treatment options? Like, have you noticed anything that stood out to you that's frustrating or maybe that's promising? I know you shared a bit from your story, but I'd love to hear more.
Yeah, I was gonna say, you go through a period of time when you're first diagnosed, if they don't tell you need to start chemo next week, okay, that one, I can't even imagine, you know, what that's like. But you do go through a numbness period if you didn't need treatment right away. So like me, there's a woman and that comes and goes from our group who just is having a really hard time. I mean, it's been years. I think she was diagnosed around the same time as me and doesn't need treatment yet, but can't wrap her head around it still. So you go back and forth. And of course, I actually was on a local meeting this week and I heard it a couple times. I trust my doctor. I trust my doctor. So there's still a group of folks that won't do any research on their own, but they still come to the monthly support group. So, you know, they're listening, and it takes a while. You don't know. Yeah. You don't know if you're coming or going. So you got definitely a mixed group. And sometimes you have the person who's got it all figured out. And sometimes, you know, you have enough wisdom to realize that they really aren't getting the best treatment they could possibly get. But you have to learn to be patient and understanding. And I think what's most important is the compassion. So we're not educators, except we've fallen into the educational category, you know. So first, I'm your friend and a compassionate. I'm also we're cancer survivors because we're seeing each other face to face on the Zoom meeting, or in the post. It's still a type of what, you know, we consider face to face in a way. And, you know, I've hugged, you know, two cancer survivors in the last year. You know, I've had that opportunity. So we're people first, and then we can be, you know, helpful if they're willing and able to absorb it, because everybody's in a different place mentally as well.
Lisa, you know, if you were to pass on any wisdom to people going through what you went through, or, you know, in all your experience of helping others, what piece of advice, what words of wisdom would you offer them?
I would say don't suffer in silence. That's something that I say frequently. And don't be afraid to say how you really feel. Join a group like ours and say how you really feel, because undoubtedly there's somebody else that's been there or is currently feeling the same thing and needed to hear what you had to say. And also, I mean, in regards to this being a group, you know, Heal Mary being a group which has and is striving to make the information accessible, you know, give it a chance. You know, give it a chance if you're being presented with an opportunity to join a trial and it works for your schedule, and you're helping them to make better decisions for us into the future. So I just think that's the most amazing thing too.
Appreciate that.
Thank you so much, Lisa. And Hannah, I don't know if you had anything else to add, but Yeah, we just appreciate so much of your wisdom and just painting a bit of the picture for us of what the past few years have looked like for you and your strength, and ability to, share that and put that back into the world to help others. So I just want to say thank you for sharing your story with us and letting us see a bit of that. So yeah, thank you to Hannah for being here as well. And yeah, everyone.
Yeah, thank you so much, Lisa. I feel like, at Heal Mary, we are trying to help patients all the time, but we don't always know what the stories are like. And so it's just been so valuable to hear what it was like for you each month and each year of your diagnosis, and just to kind of be able to empathize and have more compassion when we're dealing with different patients. And so, yeah, I mean, you're such an advocate and you're just doing such amazing work too. And so just thank you for being here, and thank you for sharing your story.
Well, thank you so much for having me, and I look forward to, talking with you guys and using your information for our group, being able to explain what you do and what you provide, because it's so vital.